This happens every husband when his wife completes her pregnancy terms around 9 months. This moment is very special for every parents. But sometimes after reaching the hospital, things may not go as expected, like in this situation. After the doctor does an ultrasound, they say that normal delivery is not possible, and now the only option is the C-section. Now, what is a C-section, why is it needed, and how is the procedure done? Let's see in the today's video. A C-section or cesarean section is when the baby is delivered through surgery when normal delivery is not possible. This is done when normal delivery could be dangerous for the mother or the baby. Let's look at some of the main reasons why C-section may be needed. The first reason is the baby's position or breech position. If the baby does not turn correctly in the womb, it is called breech. There are 4 main types of breech positions. Complete breech. The baby is bent at the knees and the are in the front of the baby. Frank breech. The baby's legs are stretched upwards with only the hips pointing downwards. Footling breech. The baby extends one or both feet outside the womb. Transverse. The baby is laying sideways, making it impossible for the head or feet to come out first. In these cases, doctor usually suggests a C-section to avoid any risk to mother and babies. Other reasons for C-section may include placenta previa. In this case, the placenta covers the opening of the uterus, making normal delivery dangerous for both the mother and the baby. Fetal distress. If the baby's heartbeat becomes abnormal or there are other issues, a C-section may be necessary to avoid complications. Previous C-section. If a woman has had a previous C-section, she might need another one because normal delivery could cause the uterus to tear. Twins or more. If there are twins or more babies, a C-section is often required. I have already made a video on how twins are born and in which cases C-section is required. You can find the link in the I button or description. Now let's look at how a C-section is performed. The woman is prepared for surgery. A catheter is inserted to empty the bladder, and anesthesia is given to numb the lower part of the body. Then a cut is made in the lower abdomen. The skin, fat and muscles are cut, followed by a cut in the uterus. After that, the amniotic sac is opened and the baby is carefully taken out. The umbilical cord which connects the baby to the mother is then cut. After that, the placenta is removed from the uterus. The uterus and other layers are stitched up and the incision is closed. After surgery, the woman is moved to recovery room where she is monitored. Most women stay in the hospital for 3 to 4 days, and full recovery at home takes about 6 to 8 weeks. So this was the entire process of C-section and reason behind it. If you found the video informative, don't forget to like, share and subscribe to our channel.
This video is only for educational purpose according to YouTube CDSC guidelines.